Hey, everybody, in this episode, you will see Ben, Dr. T, and Eric. I needed some time to decompress, okay? We had just gotten done recording an episode, and I had to get my thoughts together. And to be honest, I've been out with family issues, and I was transparent about that in the previous episode. So today, the three of them kick this one off, and they're in the big book, and they're talking about some pretty cool topics that we don't really discuss much. Now, before we get into that, I do want to talk about the Sobriety Network. It's our Facebook group. I want you to join that. Go to Facebook, type in the Sobriety Network, and also join us on our big book study. That is every Monday at 5 o'clock p.m. Eastern Time, and it's myself and Eric, and we go live, and you can find that at ruralrecoverytalk.com/bigbookstudy. Just plug in your email, and you're going to get a Zoom link every single week, and it's 100% free. It's a great resource for you. So I just hope you enjoy this episode, and I will see you soon.
Is it close enough? Is that close enough?
Yeah, you got kind of soft on the last one.
Okay, well. So you want me to kick this one off?
Let's do it.
Yeah. Should we give a little...
Well, go ahead.
Have you heard of the Big Book of Alcoholics Anonymous, but you don't really know what it is or what it consists of? Well, it has gotten millions of people sober at this point. It came out in the 1930s. And myself and Eric, we want to take you on a journey through the Big Book so you can better understand what is in this book. It's very influential and has helped millions of people. Now, how do we do this? We go live every single Monday at 5 o'clock p.m. Eastern Time. How can you become a part of this? Go to ruralrecoverytalk.com/bigbookstudy and register. It's 100% free. I want to see you there. Family members, loved ones, people in recovery, you're all invited. It's for absolutely everybody. So if this is something that you're interested in, again, realrecoverytalk.com/bigbookstudy, register, and I'll see you on Monday.
We're going to talk about drugs and Alcoholics Anonymous.
Yeah, we are. Let me give a little preface to this.
Yeah.
I want to tell you about my experience. So I go to my first treatment center, right? I had only been to one AA meeting in my life. It was at the Oasis Club. I went one time. My friend dragged me there after surfing. So I go to treatment in Palm Beach Gardens at a spot, and they do H&I, hospitals and institutions, but it was open.
What does H&I mean? Can you please break that down, coming from someone who might not know what H&I is?
So Alcoholics Anonymous and Narcotics Anonymous, all the A programs, they have an official, I don't know, what would you call it, board, so to speak? Sure, for lack of a better way to put it.
Exactly.
That is specifically responsible for bringing meetings into institutions, hospitals, treatment centers, things along those lines that don't necessarily have access or the ability to go to an outside meeting. So essentially, if somebody's in a hospital or a detox, a residential center where they can't leave, a representative from AA that has officially gone through the H&I
training?
No, it's not a training. You're just basically going there. You meet certain qualifications, so to speak. Generally speaking, don't quote me on this. It's been a long time since I've been involved with a real H&I.
Mm-hmm.
That goes back probably 10 years for me since I had a commitment at CARP. But you had to have 6 months sober, I think.
Something like that, yeah.
And, I forget. Me and my
no,
buddy
I just
Dennis
asked just for people who might not know, because I only know about it because of working in the recovery world. And a lot of the inpatient settings, your detox and residential that's part of their curriculum. They have H&I speakers come in. So just so for everyone out there who might not know what that is.
And just to throw it out there, a lot of treatment centers do unofficial H&I and don't actually go through AA.
Okay.
Or NA. They
Which
just
is fine.
Wing it. In my book, that's fine. Yeah, teach your own, whatever. I don't get involved in the controversy. But anyway, I show up.
You're going to tonight.
Yeah, we are. I show up to treatment, right? And they bring a meeting in, but it's open to the outside. It's an open meeting. So we literally probably had about 50 people show up from the outside. So here I am at the treatment center that I'm attending, right? And I sit outside. Mind you, this is only my second AA meeting ever. It's outside, overlooking Juno Beach. and the chairperson sitting there, and they do a go round. Everyone has to introduce themselves, right? Where you say, "Hey, I'm Ben. I'm an alcoholic," right? I go around. I don't know any better.
Oh no.
You know, I drink alcoholically? 1,000%. I'm an alcoholic. But like, I was doing a lot of crack and a lot of Oxycontin and some heroin and all the drugs, right? So it comes around to me. Mind you, there's probably, including the clients, there are probably 70 people in this meeting. And I remember I call out, it gets around to me. I'm like, "I'm Ben and I'm an addict." And the chairperson goes, "What?"
No.
I thought because we were outside and it was breezy, he couldn't hear me. I said, "I'm Ben and I'm an addict." And again, he goes, "What?" Third time, "I'm Ben and I'm an addict." "What?" Finally, the guy next to me nudges me and says, "It's an AA meeting. You got to call yourself an alcoholic." This dude's intention in my book was to embarrass me.
Yeah.
A guy, you came into my treatment center that I was attending. I had no idea what the proper
terminology was.
whatever, to go about this, and went out of his way to embarrass me is the way that I saw it, right? Guess where I didn't want to go after that? I no longer wanted anything to do with Alcoholics Anonymous. I was like, thank God that place took me to Narcotics Anonymous at the time. But perfect example of how people in AA or NA or NEA, because it happens vice versa. You go in an NA meeting and say you're sober, they'll lay into you if you don't say clean.
Oh.
That nonsense needs to stop.
Why do they
from
lay
all the
into you?
fellowships?
What for all of them? It's well because they're just
It's petty.
ego, it's petty, and you know the book says our maximum purpose is to fit ourselves to be of, or our purpose is to fit ourselves to be of maximum use to God and to others.
And the alcoholic who still suffers.
And the alcoholic who still suffers. And look, I have a very good friend of mine. He watches our big book study, and him and I had a very a debate about this, and he's got a total point. I understand where he's coming from. The for AA, it's the unity of the we can't help everyone, and it's let's stick with alcoholics, and I understand that. And today I leave it up to the group conscience. I leave it at my group that I attend. I found the group that, hey, you can talk about drugs in here because you find me an alcoholic who's not cross addicted, who doesn't do cocaine and doesn't do that's it. It's very hard pressed to find just an alcoholic today, right? So it's part of your story. It's part of your story. I hear people introduce themselves. I'm a alcoholic drug addict. Okay, that's like saying I'm a German Shepherd and a dog, right? Like it's the same thing. But I'm going to read this. You want me to read this?
Let me say this too real quick, where the whole point in it coming about, singleness of purpose is what they refer to it as a tradition, has to do with the fact, like Eric was just saying, like, for instance, we don't want to end up with overeaters and Alcoholics Anonymous. The people, like, just to call it what it, in my opinion, fall outside of alcohol substance abuse.
Yeah.
But Alcoholics Anonymous is like alcohol only, at least individuals in that program. But
there's a and what you're saying, there's a difference between just identifying as, well, I didn't do alcohol, I don't drink at all, I'm a drug addict. And there's a difference between that and people saying, no, you can't talk about drugs in here. You can't talk about drugs in this meeting because that's part of your story. You can talk about it, and we're going to read about that here in a minute. But the difference and why I think a lot of times people say this in AA with the drugs is I suffer from an allergy to alcohol. When I put it in me, it creates a phenomenon of craving that compels me to drink the next one. It's an allergy is an abnormal reaction, right? To something ingested. So I have an abnormal reaction to alcohol. If I'm shooting heroin, the normal reaction to shooting heroin is to become addicted to heroin. That's a normal reaction. That's not an allergy when I shoot heroin and I become addicted to it. People drink alcohol their entire life and don't become addicted to it. You shoot heroin for 3 days, you're addicted to it. So there is a difference, right, when it comes to breaking that down, which I understand. But I'm going to the point here where when people say, and you hear it in meetings all the time, you can't talk about drugs in here, keep it on alcohol. Well, I'm going to read something here where This is from Dr. Paul, and this is in the 4th edition of the Big Book of Alcoholics Anonymous. And I read this in meetings sometimes, and I have old timers, and no offense to old timers, we wouldn't be here without them, but they're still in the 2nd edition or the 3rd edition. The new editions come out because they represent, Bill and Bob understood that Alcoholics Anonymous was going to transcend them. It was going to go on long after they did. And we had to have every new edition, they take stories out, they put new stories in to represent the current membership of Alcoholics Anonymous. So the 4th edition, and they're about to come out with a 5th one now because it's been almost 20 years, I think.
Mm-hmm.
The 4th edition represents the current membership of Alcoholics Anonymous. And if you sit in a meeting and you look around, the heroin addicts, the white vans that pull up, this is the current membership of Alcoholics Anonymous. Like it or not, this is what it is. They're here. They're asking us for help. We can help them. We have a solution for them. How dare I say we don't? So Dr. Paul wrote Acceptance is the Answer. Dr. Paul was a pharmacist. And Acceptance is the Answer, we read a paragraph from it at the end of almost every meeting, we read a paragraph. It's a reading that we pass.
Highly celebrated alcohol.
It's the most celebrated chapter in here. And so Dr. Paul tells his story here, which is just like our speaker meetings. You speak for 30 minutes. I'm going to read you an excerpt.
Let me say this. The problem is people don't read the whole story. They only read the little paragraph at the beginning of the meeting.
No, and I've sat in meetings before and read this and seen people in that meeting, old timers going, that's not in the big book. He's not reading from the big book. That's not in there. And yeah, I'm reading from the big book, the 4th edition of the big book on page 410, Dr. Paul. So I immediately started taking and shooting pep pills. Eventually, I was taking 45 milligrams of the long-acting Benzedrine and 45 of the short-acting just to get out of bed in the morning. I took more through the day to increase the high and more to maintain it. When I overshot the mark, I'd take tranquilizers to level off. The pep pills affected my hearing at times. I couldn't listen fast enough to hear what I was saying. I wonder why I'm saying that again. I've already said it 3 times. Still, I couldn't turn my mouth off. For the leveling off process, I just loved intravenous Demerol, but I found it hard to practice good medicine while shooting morphine. Following an injection, I would have to keep one hand busy scratching my constantly itching nose and would also have sudden uncontrollable urges to vomit. I never got much effect out of codeine and Percodan and the tranquilizers. However, for a period of time, I was injecting pentothal intravenously to put myself to sleep. That's the stuff used when the oral surgeon puts the needle in your vein and says count to 10, and before you get to 2, you're asleep. Instant blackout was what it was, and it seemed delightful. I didn't feel I could lie in bed and squirt the stuff in my veins while my kids and wife stood around watching me, so I kept the drug in my bag, and the bag in the car, and the car in the garage. Luckily, the garage was attached to the house. In the garage, I would put the needle in my vein and then try to figure out exactly how much medication to inject to overcome the pep pills while adding to the sleeping pills while ignoring the tranquilizers in order to get just enough to be able to pull out the needle, jerk the tourniquet, throw it in the car, slam the car door shut, run down the hall, and fall in bed before I fell asleep. But you can't talk about drugs in an Alcoholics Anonymous meeting. And I read that and I will see people scrambling through their book. That's not, what's he talking about? That's the current membership of Alcoholics Anonymous. Like it or not, I had a friend of mine saying, this is very true. A lot of what's in this book is up for interpretation. We talked about this earlier.
Yeah.
What's not up for interpretation is when you got to explain to the mother of a 23-year-old overdose kid that died, explain to her why he didn't feel comfortable in an Alcoholics Anonymous meeting. That's not up for interpretation, man. So we need to really be careful the message that we carry, right? Because we're stepping over bodies. They're coming to us for help, and we absolutely can help them. And we have an obligation to do so.
Wow.
You find that, though, I mean, I've never heard that, obviously, but it just had my wheels spinning because when I see patients especially in the detox, right, like the very beginning stages of their recovery journey, those same behaviors ensue in the treatment center. Those behaviors don't change. But from my perspective, it's, hey, I'm feeling bad. Can you give me something that's going to give me energy, that's going to wake me up? Then it's, well, now I have energy throughout the day because I'm taking this medication. I'm drinking 400 milligrams of caffeine. I'm smoking cigarettes. I'm, drinking coffee throughout the day, at the meeting at night before I go to bed. Now I can't sleep. So I need you to give me something to make me sleep. So now you give the patient something to make them sleep. And now they're chasing their tail because of those same behaviors, not understanding or recognizing that those same behaviors are what got them into treatment. And that's what comes with the overprescribing from a provider standpoint. And I don't think providers understand that. Right. And that's where it comes in, working in the field and trying to sit down and have these conversations with these patients when you see them. But when I try to explain that to them, I am useless to them. I cannot help them, because how do I, after meeting them for 1 week, 2 weeks, 3 weeks, explain to them that their behaviors still haven't changed?
Right.
They're still chasing that up. They're still chasing that down, that those behaviors still need to be addressed and haven't changed.
Hey, first off, thanks for letting me interrupt the episode. I want to take this time to invite you into the Sobriety Network. It's our Facebook group that we put together, and it is open to absolutely everybody: family members, loved ones, people in recovery, people that want to be in recovery. We want to see you there, and you can just go into Facebook, type in the Sobriety Network, answer a couple of questions, and we'll let you in. It's a good place for you to come and just talk with people, ask questions, interact, and get the support that you need. So I'm excited to see you there, the Sobriety Network.
Here's the other importance to being educated on this and knowing that within the literature it's there, because one of the things that we face too as a center, for instance, it just is the way that it is logistically at our center at Rock. It's AA meetings are more prevalent in the area.
Yeah.
It's, for whatever reason, it's a longer drive in our van to get to NA. It's very hard logistically for us to get that done as a staff. But I'll have guys come in here, or ladies, and be like, "Oh, I want to do NA because I'm not allowed to talk about drugs in AA." And I have to explain to them, I'd love to get you to some NA meetings, and when you get to IOP, you can get to some NA meetings. And I encourage that if that's what you want to do. Unfortunately for us, we're kind of bound a little bit logistically on that. As much as I'd love to be able to take you to meetings all across Florida, go whatever one you want, I can't. It just won't fit in the day.
When they get out, they can do that. The whole idea of not, that's why I always tell them, when you get into IOP, when you're, I don't go to the same meetings that I take patients to. I don't.
Yeah.
I found my tribe. I go to men's meetings of guys like me. I found my tribe. But telling somebody you can't talk about drugs in an AA meeting when drugs are part of their story, right? So what brought me here was crack cocaine. That's what got me into recovery. I started smoking crack cocaine at 56 or at 46. I'm sorry, I'm 53 now. That's when who starts smoking crack at 46 years old? It was 2.5 decades of alcohol that got me to smoke crack, but it was crack that brought me in. So when I tell my story, am I supposed to leave that part out?
Remember we had a patient like that here? I don't even remember him. I really liked him. He was one of the funniest guys ever. I'm not going to say his name, but I think he was 53 or
52.
He was 52.
Smoke crack for the first time?
Crack for the first time, and it just ruined him. It ruined his life. It ruined...
Within a year.
But today
or 9 months or something.
That was my story. But today I'm grateful for that, because had I not had that bottom, I might still be out there selling cocaine and drinking and going to the bars and stuff, had I not gone to that bottom. It accelerated it so quickly.
Yeah, that's true.
Yeah.
It got you there. Yeah. But that's the thing too, is because I'll literally use that passage when I have a client sit in front of me and they're like, and I'm trying to get them to be open-minded. Hey man, just for the time being, while you're in PHP, bear with it. Let me show you something in the big book. I show them that story. I also show them where it refers to his alcoholic addiction. I also show them where in Bill's story, he talks about morphine and sedative. So it's part of his story. Dr. Bob, it was a part of his story. Dr. Bob, in particular, actually would take pheno and phenobarbital during the day so he could go to work. And then he wouldn't drink until night, but he was pilled out all day. Do you know what kind of doctor Dr. Bob was?
No, what kind of doctor was he?
He was a proctologist.
Proctologist.
Oh, really?
So you bet your ass when you go see Dr. Bob is what they used to say.
But that's what that you talk about that. Like, I hear a lot of people too. There's arguments. It's very controversial. Like, there's no such thing as cross addiction. I get told that all the time, especially in this setting. Meaning, like, I have patients say, well, why can't I have my Adderall? That wasn't my drug of choice.
Right.
I'm an alcoholic. So I don't understand why you won't let me take my Adderall. I've never abused it. It was a prescription from a doctor. It helped me function in my life. And I think that I should be able to take that medication while I'm in this center. And I will continue to use that medication when I leave here. So you should just let me have it. I have this conversation more often than I would like to. And even I've had patients' families yell at me about it. My daughter needs her Adderall. You don't understand what you're doing to her. She's not addicted to taking Adderall. Well, the fact that you guys are both arguing that to me makes me believe that there might be a problem here, guys. But I get that argument all the time. There's no, like, one, how is that an issue? There's no such thing as cross addiction. And that's just like a loaded.
Well, there's cross using because we all do that.
Right.
Whiskey,
right.
cocaine and whiskey went together like peas and carrots for me. So
Yeah.
I mean,
I could not drink. I got to the point in my alcoholism, I could not drink without Coke.
yeah.
Like, it was the worst thing ever. It didn't start off like that. But when I was like into my Coke and crack use, like, I had to be drinking. And I had to be doing Coke or crack with it. Like, it develops into
that. Was
that.
how mine was.
And I can't tell you how many cases I've come across with the Adderall, and specifically of alumni of ours that said the same thing. They got their Adderall prescription. They're going to go back to it. That end up going back to drinking because, let's call it what it is. It's a speedball for them.
Yep.
You got the Adderall that's the upper,
Mhm.
the alcohol that's the downer. They think that the Adderall's not a problem. Next thing you know, they want the alcohol to take the edge off from the Adderall, and they're back at it. I can't tell you how many readmits we have here at Rock
And also
over Adderall.
Yeah, and going back to what you were saying with relation to the big book, why do you think that Bill W. used phenobarb during the day?
Yeah.
Phenobarb acts on your brain the same exact way that alcohol does. He was a physician. He understood that. That's why he was smart. That's why he used it during the day so he could function, so he didn't have to smell like alcohol, get wasted. He knew exactly what dose to take to make him function throughout the day because he knew. Now that's going back to cross addiction. So if you take benzos during the day, but you're drinking at night, you're never coming off the substance. You're using two things that do the same exact thing on your brain. Your brain doesn't know the difference between alcohol, a benzo, phenobarbital, zero difference. It acts on your brain and your body the same exact way.
That's what I was taught in school. When I went with Tom and we met and he took me out for a burrito, we
Of course he did.
the class was pharmacology of drugs of abuse, and the term cross addiction, the way that I was taught, is the only drugs that you could be cross addicted was alcohol, benzos, and barbiturates, because you can literally replace them. Hence why in detox, like, you use benzos to come off alcohol. They used to use barbiturates,
Some places
right?
So how about
use barbiturates? Some places do. The hospital does in severe instances. Yeah. Most places use benzodiazepines.
So they can literally replace each other, where that's like the cross addiction part. But you can't necessarily be cross addicted.
But let's take out the addiction part, though. How about just using a substance in the manner that it's not intended for? I used to take, I'm not addicted to Xanax, never was, but I used to take it to come down from cocaine.
Oh, yeah.
All the time. I'm drinking, and then I do cocaine all night, and I got to go to work the next day, and I'll take Xanax. And I'm not prescribed that Xanax. I'm not addicted to that Xanax, but I'm using it for something other than what it's used for. Yeah, that happens all the time.
That was the only thing I used Xanax for, was sleeping after a big coke binge.
But some people firmly believe and have a guided discussion with me about and trying to convince me. You don't have to convince me, is what I tell the patients. Listen, I am an open mind. I am not here to tell you right from wrong. You don't have to convince me of anything. You have to convince yourself.
Right.
And it's your own actions, it's your own journey, and you're going to make whatever decisions you make and suffer the consequences of those decisions, with that. So,
and that's the can't see the truth from the false, and when their mind's not going to see that. If I got a prescription for an opiate or something, and I wasn't addicted to opiates at the time, never have been. But if you gave me if I got a prescription for Percocet when I was injured, it says my name's on the bottle. It says take 4 a day. I'm 4 on the way home, and I'm like, oh, I just I didn't become addicted to them, but I abused them when I had them.
Yep.
Because they gave me a feeling.
right.
I would have become addicted to them if I didn't drink so much, probably. But either way, I wasn't using them as prescribed at all.
And I liked how you talked about the current membership too, when you like how it, call it what it is. In my opinion, AA, NA, we need to change with the times. Absolutely need to change with the times. Like that.
The only thing that doesn't is our text.
For instance, I think a good line that I like bringing up, I used to read it all the time. Step over the nearest bar room and try some controlled drinking. That's a quote out of the big book. Like if you're questioning whether or not you're an alcoholic, it's literally telling somebody to go drink. Nowadays, you got fentanyl addicts in there.
Oh.
You can't tell them, hey, step over the nearest trap and try some controlled fentanyl use. Like you can die on your first try.
Mm-hmm.
So it's like...
But again, there's a difference in that allergy too.
Yeah. I think it just takes longer. Yes, you'll get addicted to heroin a lot faster, but alcohol, you put enough in your system.
If you put enough in your system, but my point on that is that there's people who drink all their lives, not alcoholically, but they drink all their lives. You're not going to find me one person who's done heroin all their lives at least once or twice a week and isn't addicted to heroin.
I get what you're saying.
Like alcohol is something that you can have people drink like that every week. They don't get drunk and they don't get, they have a couple drinks, they go have dinner, go to bed. That doesn't happen with crack.
No, crack.
Or heroin.
You become addicted to it.
I don't know anyone who takes one hit of crack and stops.
Yeah. And so.
Or meth.
Yeah. And any of that stuff. But, again, I have a friend of mine that talks to us all the time. If you put all these people in a room and you give them heroin every day, you've heard me say this before. If I put 20 people in a room, give them heroin every day for 30 days, I've got 20 heroin addicts at the end of those 30 days. There's no doubt about that. I do the same thing with crack cocaine. At the end of those 30 days, I got 20 crack addicts. There's no doubt about that. I do that with alcohol for 30 days. When they're done after those 30 days, I'm going to have whatever percent of the population are alcoholic. I'm going to have that 2 or 3 alcoholics, right? So you go back to the heroin addicts. I send all them off to detox and get them better. When they come out of detox, the same number that are the alcoholics, 2 or 3 are going to go back to heroin because they have that obsession of the mind. They're real addicts. The rest of them are going to go, I'm never doing that again. And they're going to shuffle off, right? But you're going to have that percentage that has that twist of the mind because the disease centers in the mind is what I've learned from my experience is disease centers in the mind. I'm always going to have an allergy to alcohol. If I pick up a drink 20 years from now, I'm going to start drinking again, right? So it's the obsession that I need relief from that the program relieves me. And I compare it to a peanut allergy all the time. If I have a peanut allergy and I eat peanuts and my throat closes up and I get really sick. I get really sick from the allergy of the peanuts because I ate peanuts. Once that stuff's out of my body, I'm no longer sick. I recover from the sickness of the allergy. But if I decide to try Skippy 20 years from now, peanut butter, because it's different, I'm going to get that allergy. I'm going to get sick again and I'm going to have to recover all over again. We see it in rehab.
Going back to the cross addiction of the peanut allergy, if you're an addict like me, you're allergic to the peanuts. Next thing you know, I'm like, you know what? I'm going to try walnuts. Right. I'm going to try hazelnuts.
Exactly.
I'm going to try cashews.
See what happens.
And that's what I say when
Which
I always
ones
say
will work?
we pick up and we use on the lie. An obsession of the mind is a thought so powerful it makes you believe a lie.
Yeah.
And that lie would be, walnuts would be different.
Walnuts are the crack.
Yeah.
Peanuts were the alcohol.
Yeah. So there is a difference in the two, but there's not a difference in the obsession of the mind.
Oh, nuts. Oh. Wow, that was good.
Yeah.
We got to do another one next week.
Did we shift gears there in the middle?
We did shift gears.
What did we talk about?
We should
Yeah, I
kind of close this out. I don't know what happened.
I was looking at you to see if you got it.
What?
I don't know.
That's all you
Let's summarize this, though. That this goes back to the importance, because I want to tie in, Eric's doing the Big Book study on Mondays, straight out of the Big Book. That is where the program comes from.
Yep.
And opinions kill alcoholics. That was one of the first things my sponsor ever told me. And you get a lot of opinions in meetings.
Okay.
As a newcomer, how's a newcomer supposed to know what is and what isn't? Hence why I opened up with my experience about that guy laying into me. And all he did was embarrass me, and I never wanted to go back to AA.
Right.
Thankfully, I had people that came into my life later on, brought me into AA, and showed me what AA really is and what it isn't, right? What's the book saying? What's it not saying? What's the actual program? For instance, gratitude lists have nothing to do with Alcoholics Anonymous. It's not part of the program. But you have 80% of the sponsors out there in the world tell you to do a gratitude list.
Yep.
Hopefully they're prefacing, hey, by the way, this is sponsor Ben's program. I'm going to have you do a gratitude
list.
It's
not necessarily a bad idea.
It's not a bad idea.
But it's not in here.
But it's not in there. And that's the importance, because, again, opinions kill alcoholics. You start watering that thing down and people start making stuff up. Don't realize Dr. Paul's story is in the back of the book.
Mm-hmm.
People start dying.
Yeah, and listen, I say it all the time, your process is your process, and it's going to be different within the parameters of the 12 steps. Just because it's an opinion doesn't mean it's wrong. No,
Correct.
There's some really good opinions, but it doesn't mean it's right either. It doesn't mean you have to do that, or you're not going to, because we set people up for failure. Well, wait a minute, your sponsor doesn't tell you to call him every day? Oh, well, you better get another sponsor. I don't have my guys call me. I don't want my kids to call me every day, dude. Are you kidding me? What I want you to do is I want you to take some suggestions, and I want you to take some responsibility for yourself. That's what I want you to do. Call me when you're up here and but I don't need you to check in with me every day. But some guys do that, and that's fine. I'm not saying that you don't, it's just not what I do.
And you got to let people have their experience too.
Right.
I'm going off on another rabbit trail, but you can chime in on this. I do believe on occasion, you can't, my sponsor would say, you can't deny someone their experience.
Right.
This can tie into medication stuff too. We have a case here we were talking about Monday, and this individual really struggles with medication management. He's at a lower level of care. Overall, I'll be honest, done very well. Like, for a young guy, very proud of him. He's come very far. Struggles with medication management and legitimately needs medications for depression.
Mm-hmm. Yeah.
But we, as a staff, like, for instance, we bring it up like, oh, we should be managing his meds. And I went the other way and kind of suggested, is this a situation where we need to, we've been managing them. We've been helping him. We've been going to him. Did you forget your meds? Did you take them? Checking them. Is it now time where we step back, let him do what he's going to do, fall flat on his face, within safe parameters? I ain't going to put someone in harm's way. And
right.
Yeah.
if they need a higher level of care and I'm afraid of like death, like,
Right.
But however, there's sometimes, like you were just saying, you got to let someone have their experience, step out of their way. I had to find out for me in AA what was right and what was wrong, so to speak.
Yeah.
Not, you know what I mean?
Yeah, no, absolutely. Sometimes you have to let them struggle forward. I mean, that's with anything, kids in life. You've got to let them learn
their
that
mistakes.
lesson, right?
Yeah, I think by us controlling that situation, it is a detriment to that person,
Right.
because they are younger, and there has to become a time in their life where they take initiative and they take the responsibility for themselves in order to grow as a human being and to navigate life's endeavors, because they're not going to be in this controlled environment forever. So I agree with you. It's better to let them, quote unquote, maybe fail within our controlled environment, so we can actually help them see what that failure looks like to them and why it's helpful to them to learn from that failure, so we can then help them pick up the pieces and move forward.
We don't want to be the
Dr. T,
enablers.
that goes right back to what I said earlier about allowing them to teaching them learning how to advocate for themselves. This is what I'm on. This is why I'm on it. This is where do they ever going to learn that if we don't at some point, because they're just going to come out of our care and go to an apartment somewhere, and they're never
Or
gonna,
sober living, and then they really
don't get it.
We can't do it for them all the way up to the end. Then we're
can't.
doing exactly what we tell the parents not to do.
And this goes right back to what I say in AA, NA, whatever. Within those 12 steps, man, they taught me how to grow up to a point where I became whole again here, and I was able to see this stuff and able to start taking. Okay, I've got an illness. I need to fix that.
Well, they get you to the point where you can start thinking for yourself again. Because that's another myth that I hate. Call your sponsor every day and check in with every single little problem. If you buying a new car, you better ask them what color to get. That's nonsense. You work those steps, you get to the point where you can think on your own again.
Yeah, exactly.
That's the point.
And that's it.
And know when to ask for help too. There's a healthy way to know when to ask for help.
Yeah, look, if you're doing it right, I mean, I'm going to check. And that's the other thing. I do call my guys. You hear other people say all the time, "Oh, I don't call them. I don't check." Well, I call mine. If I don't hear from them for a couple of days, I'll check. Hey, you all right? You doing good? What's going on? Why? I mean, the book that's what they did.
I call it the courtesy call. I call my sponsees when I don't hear from them, and I say, "Hey, man, this is my courtesy call, dude.
I just call.
I haven't heard from you. I want to check on you. It's a two-way street."
I call them because I care, man.
Yeah.
Yeah, not that. Oh, I'm not going to call.
No way. Dude.
They got nothing I want, dude. Really? That's not How about? I mean, I'll get off.
But that's good. But
I'm with you. We're the same.
But this helps me see and understand, especially from an outsider's perspective, why it's important to be involved in something like this, to have a sponsor or have an accountability buddy, whatever you want to call it. Because, for instance, I was listening to Tom on a call today with a loved one of someone who's struggling with intermittent relapse and use, who's kind of in denial still, I guess I would say, and resistant to treatment, resistant to AA. But this is why it would be important for people like that to gain a fellowship, a relationship with someone like them in their own situation, because they have this preconceived notion that AA is like a cult or whatever negative connotation you want to say to it. But it's about accountability. It's about having someone that you can connect with. It's about having someone who went through the things that you're going through, they are going to help you see your struggle because you're in denial. And they're going to help you come out of that denial, acknowledge it, accept it, and help you pave a path to move forward in. And I think that's what people who are struggling or in denial with their use, they lack that. They need that fellowship. They need that guidance, that connection.
Yeah, and they need someone to tell them the truth about themselves. And I can do that because I was the same way.
Right.
I can say that to you because, hey, I was that guy, man. Somebody had to tell me the truth about myself. I didn't like it. But
that's why the big book says a man armed with the facts about himself. I know Eric because I know me. Eric knows me because...
Yeah, so when an addict or an alcoholic's giving me the business, lying to me, I can tell. I just know, because I did the same thing. I just it's like a sixth sense,
But coming from you guys, that's helpful to them.
Yes.
Coming from me, it's condescending.
Yes.
It's I don't know anything. I'm a normie. I didn't go through it. I don't know what I'm talking about. Again, don't take it personal. It's not a dig at me. I respect that, and I understand that when people say that to me. Completely get it. But I'm going to help you get to someone or something that you can relate to, that can help you.
But you've been doing this long enough that you can recognize the behavior as much as I can when someone's lying to you about that. You can recognize the behavior of the addict and the alcoholic just as well as I can.
But my receptiveness is, I would say it's a 50-50 shot, right? Yeah. I'll have someone tell me to go F myself, or they'll be like, oh, well, tell me more. It's a 50-50 shot. So
it's so funny.
Then I'm like, hey, let me call in Eric or Ben. Maybe you should meet and have a talk with them.
Right.
It's so funny that Dr. T will come out, meet with someone, will come find me. that person's so full of crap.
Like, they're such a liar.
Yeah.
But I just
I know you
listen
said
and
it to me
smile.
before. In fact, I've been like, I think they're really. And you're like, nah.
Nah, that's bullshit.
Oh man, I feel like we're gonna keep gabbing. So
Yeah,
why don't we, in honor of Tom not being here, we'll use this line. Let's start landing the plane, or maybe the plane just landed.
Yeah.
The end.
Till next time.
Yeah, we started off.
Bye, live people.
We started off strong.